There's many more mistakes that are going to happen. There's less care that's going to happen, and it puts our patients at risk.
As nurses at Rochester General Hospital prepare to strike next week, they're delivering a word of warning. Good evening. That warning comes as those running RGH say there will be no disruption should the strike happen.
But some nurses told me this week that that's impossible. Even if hundreds of nurses at Rochester General Hospital walk off the job next Thursday and Friday in protest of working conditions, administrators there say care will not be negatively impacted. But nurses like Stacy Judson doubt that.
All along, they don't seem to be as prepared as they're letting on. We have had safety concerns from the beginning, so we anticipate, unfortunately, they'll continue.
But RGH says on their website, quote, "We have contracted with a nationally respected agency to hire temporary replacement nurses who have been carefully screened, selected, and trained on RGH's systems and protocols." Stephanie Oldfield works as a nurse in labor and delivery and says even if they manage to bring in a sufficient number of fill-in nurses, it would be impossible for subs to provide the same level of care her team does.
We're a locked unit. We know our unit, we know our patients. To have completely new nurses come in, they will not know where everything is. They will not know exactly how the best way that we work.
Training aside, both Oldfield and Judson say they don't think the hospital will have enough nurses, saying as recently as this week, former RGH nurses have been getting messages asking them to sub.
And many of the nurses are saying that the conditions then were bad and the conditions now must be worse. And the thought of working with nurses that would have no idea what's going on, there's no way they would put themselves in that situation. And they wouldn't cross the picket line.
Right now, RGH says all procedures are still on, even elective surgeries, but patients are encouraged to check with their medical team next week if they're scheduled for something on Thursday or Friday. The strike is limited to just RGH, but of course it could still be avoided. There's at least one bargaining meeting scheduled for early next week. We did reach out to the state health department about all this, and we have yet to hear back.